Before 2013, in the state of California, parents had the right to not give their children one or more of the required kindergarten entry vaccines based on their personal beliefs. Nonetheless, most parents vaccinated, and there was an over 92% full vaccination rate for kindergarten. As of 2019, parents are not allowed to opt out of vaccines unless their child has a medical reason, and we now have only 0.7% of children who are not following the vaccination code. Nonetheless, this isn't enough for the lawmakers in Sacramento who are currently working to remove medical exemptions for most of that remaining 0.7%. Coercive laws like this already exist in several other states, and they're being proposed in many other states, including Washington State, where they're currently losing the ability to have a personal opt-out from the MMR vaccine for kindergarten entry. And these laws don't stop at children who are attending schools. In the state of New York, where they're currently having a measles outbreak, in several of the zip codes, all children over 6 months of age, just because they live there, are required to have the MMR vaccine. If we are being mandated to give our children all of these vaccines, we would really like to assume that they have been clearly shown to be safe and effective and clearly in the best interest of public health in our country. So one of the big themes of this video is to look into whether that is really the case. For example, I talked about in New York right now, 6-month-old infants who aren't even attending school are being mandated to receive the MMR vaccine. Now, in New York, they're having a measles outbreak. They're not having an outbreak of mumps or rubella, which are the other M and R in that vaccine. But in the United States, a standalone measles vaccine is not available. So all of these 6-month-old infants are being mandated to receive the full MMR. Now, what I have here is a printout of the MMR vaccine insert. This is the official documentation which accompanies the vaccine. You can get this from your doctor or you can print it out from the internet. Now, in this official documentation, it states, safety and effectiveness of mumps and rubella vaccine in infants less than 12 months of age has not been established. Therefore, in New York, they are mandating vaccines in 6-month-old infants for which there has been no safety testing. If we're mandating all of these babies in New York to receive vaccines without any safety testing, then we might assume that this is because measles is a very dangerous disease. So is this the case? Now, if we look at babies in the pre-vaccine era, even though obviously no babies were vaccinated, it was very rare for a baby to catch measles. And that was because if the mother had caught measles in her own youth, she would pass on the immunity to the baby, and that immunity would last until the baby was about 15 months old in developed countries. Now, in the vaccine era, if the mother hasn't caught measles but has only been vaccinated, her immunity levels are much lower. So now the baby's immunity will wear off around 6 months. So yes, thanks to vaccination, we now have a large population of babies between about 6 and 12 months of age who are very vulnerable to measles. However, how often is measles deadly in this population? We also have a medical intervention called immunoglobulin, whereby you can take someone who's had natural measles and take a product from their blood that can then be given to the baby and will protect them from severe illness. So because of this medical intervention, the deaths from measles among babies in the United States has been extremely rare over the last 20 years. So maybe we're taking all these stringent measures to vaccinate against measles because the disease is so dangerous to the general population. So let's see if that's true. So I pulled up the CDC mortality table, so the official numbers from the CDC, and I looked at the year 1962. And I chose 1962 because measles vaccine was introduced in 1963. In 1962, we had 408 total deaths from measles in the United States. And this was out of a couple million people dying in total. But of course, most of that measles is occurring in the younger part of the population, which is less likely to die from other things. So if we just look at children under the age of 15, we have a total of 384 deaths. and that corresponds roughly to 1 death for every 10,000 cases of measles. Now, to put that in perspective, in the same year, we had 32,664 deaths of children under age 15, actually between the age of 1 and 15, from all causes. And here I'm leaving out the kids under age 1 because there are lots of deaths in newborns from birth defects, so we're not going to count that, okay? So just the kids age 1 to 15, we have a total of 32,664 deaths in 1962. That means the deaths from measles was 0.9% of the total deaths. Also, to put that in perspective, in the same year, for kids under the age of 15, and now I am including babies, we had 4,468 cancer deaths. So at the time the measles vaccine was getting ready to come out, childhood cancer was a 10 times worse problem than children dying from measles. So most parents at this time were actually not very concerned about measles. And even at that time, they had to do a lot of advertising to get parents to give their kids a measles vaccine. And not only was the death rate 1 in 10,000, that death rate was not uniformly distributed throughout the country. Kids had a 10 times higher probability of dying from measles if they lived in an impoverished area with more than 60% of the people below the poverty line than if they lived in a wealthier area. And there are 2 likely reasons for this. One is malnourishment, because we know that vitamin A status is extremely important for measles survival, and the other, of course, would be access to adequate medical care. And also supporting the malnourishment, when they looked at these kids who were dying from measles, they found that large percentages of them were under the 3rd percentile for height and weight. So a lot of the kids who were dying were very small for their age. So this indicates either, again, that they were malnourished because they were in poverty, or that they were sick from some other circumstances. So we didn't need a vaccine to reduce the small number of measles deaths. We needed to get people out of poverty, we needed to make sure they had enough vitamin A, and we needed to make sure they had access to medical care. And over the 60s and 70s, actually these things occurred. We had the war on poverty, we actually did improve nutritional status of kids, and we actually did improve their access to medical care. So if you actually look at the statistics, if you look at measles outbreaks in the 80s, and you adjust for the fact that in the 80s, older kids were getting measles, because measles is more dangerous if you get it over age 15. And after they brought the vaccine in, because vaccine immunity wanes with time, they saw that right away kids started getting measles later. So if you look at the statistics in the vaccine era, we mostly see people over the age of 15 who are dying from measles or getting very sick. But if we correct for that and we look at the total statistics of the measles outbreaks in the 1980s, we see that the death rate had actually gone down by about 2/3. And we expect that because of our improvements in nutrition and in healthcare. And in fact, this holds globally. So that means that our real death rate for measles, if we hadn't introduced this age skewing in the population, would now be about 1 in 30,000. And they recently had a measles outbreak in the Netherlands where they have a large population of people who don't vaccinate for religious reasons. So they have this large population with kids who are routinely not vaccinated and routinely do get measles. And the latest death rate there was 1 in 30,000. And that one person was a teenager who was already immunocompromised and very sick. So how dangerous would measles be today if we had never had a vaccine? So remember, with modern medical care, and if we hadn't skewed the ages, we hadn't made the babies vulnerable, we hadn't made the older people vulnerable, we would be expecting a death rate today of about 1 in 30,000. That means if we go to, say, 1998, which is a year I looked at in the CDC mortality tables, easily accessible, we would have expected about 130 total deaths from measles in the United States. That would have been in comparison to 13,042 total deaths. Yes, our total death rate is going down, which is good, which means that without a vaccine, measles would have accounted for about 1% of the total death rate. This would have still been far less than the death rate from childhood cancer, which in 1998 was 2,790. So without any vaccine, our risk from measles would have been about 1/20th the risk that we currently have from pediatric cancer. So where's our priorities there? Why are we putting so much into vaccinating against measles when childhood cancer is a much bigger deal? And not only that, but we also have a big cause of death in this country from medical errors. The recent estimates is that about 9% of deaths in this country come from problems with medicine, doctors making mistakes. So if we put that energy into, that we're putting into vaccines, into preventing medical errors, we could save far more lives. Okay, so I told you that with the measles virus, the death rate before the vaccine was 1 in 10,000. So if you're going to check for the safety of the vaccine and show that it is safer than the illness, you need to check in about 40,000 children minimum in order to get adequate statistics, okay? So did they do that before licensure? No. This is the MMR2, again, the insert that goes with the vaccine, the official information. According to the official information, there were clinical studies of 284 children. That's it, 284. And that demonstrated that the MMR2 produced antibodies and it was generally well tolerated. That is all the information that we have. That 284 children, and there's no placebo mentioned here, found it generally well tolerated. Now, if we gave 284 children wild measles and these kids were not malnourished, we just took them out of regular suburban households, we would also find that for that 284, the measles was generally well tolerated. If we only tested 284 kids, we would never know that it killed anybody. So obviously, this is very insufficient testing. Now, I think one of the reasons why they got away with insufficient testing is because they were making a lot of assumptions. They were saying the measles vaccine virus that we put in this vaccine is less powerful than the wild virus, so why should it cause any problems? Well, there are a number of reasons why you might expect it to cause problems, especially in the long term. And I should also mention that although it doesn't say so in the vaccine insert, data that's been gotten from the Freedom of Information Act indicates that all the testing that was done was not run for longer than 6 weeks. So why is it not safe to assume that these vaccines are safe for our kids just because the virus in there is somehow less symptomatic than the wild virus? Okay, there are a number of reasons for that, and to get into that, we have to go and look at some of the assumptions that people make about a vaccine. So, assumption that many people make is that the vaccine virus is the wild virus. They've just like heated it up or added some formaldehyde or done something to make it a little weaker. I think a lot of people have that conception. I know I did myself. But that is not how a vaccine virus is made. A vaccine virus is made through a process called attenuation. And what that means is you take the virus and you grow it in animal tissue or you grow it in human fetal tissue, but at temperatures that are different than body temperature. So basically you force that virus to evolve so that it grows better in the animal tissue or better in the human embryonic tissue at a different temperature than it grows in the regular human body. So therefore, when you shoot that virus into the human body, you have a mutated virus which doesn't replicate as well as a wild virus would. But that doesn't mean that this virus doesn't do anything to your body, and it doesn't mean that your body is able to clear it effectively. So you're being shot with a mutated virus that doesn't replicate as well, doesn't spread to other people as well, and doesn't necessarily cause the same amount of symptoms. But that doesn't mean that, for instance, it won't cause cancer 10 years down the line because it's sitting in your body somewhere continuing to irritate your tissue. And again, vaccine insert specifically says that the vaccine is not tested for whether or not it causes cancer, even though, as we said, pediatric cancer is a much bigger problem than measles. Okay, we also don't know if that virus, mutated virus sitting in your body, is going to result in autoimmune disease or any number of other diseases down the line, or perhaps impair your fertility. Again, vaccine specifically not tested for whether it impairs your fertility, specifically not tested for whether it's toxic to your genes. Now, this is relevant also because people also probably think of a vaccine as being a purified product. You think it's just the virus in there and these other ingredients that are on the label, and we have issues about the other ingredients. But in fact, there's many other things in the vaccine, and that's because the vaccine is grown in the animal or fetal tissue cell. And when you talk about the MMR, the measles is grown in the chicken cell, the rubella is grown in fetal tissue. Okay? Now, when they take the virus out of these cells that they're growing it in, they can't do a perfect job of separating out this live virus and leaving everything out behind. We just don't have that technology. So you also end up with animal viruses in there. You also end up with DNA fragments in there from the fetal tissue. You end up with lots of other stuff in there which has unknown biological effects in the body. So looking at 248 kids for 6 weeks is not going to show you the effect on the immune system of injecting this stuff into the body. Of course, another point is that we're injecting it. When you catch measles wildly, you breathe it in, right? This actually changes the way your immune system reacts to it. And there was actually a Russian group that tested a measles vaccine that was done intranasally, and they found that there was a totally different reaction by the immune system. Obviously, you got a lot more immunity in your mucus, called mucosal immunity, than you would with an injected vaccine. So it was a lot better immunity. The blood immunity was the same, but the effect on the immune system was more benign. As you may know, both measles and measles vaccine will both knock down your immune system for a length of time, but the vaccine that people inhaled did this less than when the vaccine was injected. Another factor that's very, very important is that the vaccine in each vial is not a uniform product. We're talking, especially when you're talking about a live vaccine, but even when we're talking about the killed vaccines, again, you're growing this vaccine in animal tissue, and then you're extracting it, and you're trying to keep it alive and keep it in this vial. And living viruses like to mutate. Okay, so in each vial, you don't have exactly the same virus. So we know that about 5% of people who get the measles vaccine will end up with a disease that kind of resembles measles. And this happens about a week after they get the vaccine. They may have the rash and everything. And this isn't just because people's immune systems are different. It's because some people actually get a more volatile form of virus in their vial. Okay, so for example, for chickenpox, I actually found the research literature where they have 5% of people, again, who get a chickenpox rash from the chickenpox vaccine, and they know it's because the vaccine that they were injected with is actually different. It's actually more powerful than the vaccine that the other people were injected with, okay? So we know that there's this variability in the vaccine, and we don't know exactly how much variability there is, and we don't know if some of this variability could really cause severe disease down the line. Right? So how can you just test on 248 people for a disease that only kills 1 in 10,000 and think that you have a safety profile when each of those people isn't even getting a uniform product? Now, there's one more safety issue that's very, very important that was not looked for, and this was the interaction between the measles virus and the rest of the viral population. So for example, if you look at an ecosystem of animals, you know that the mountain lion is killing the deer, and the deer probably aren't very happy about the mountain lion, but without the mountain lion, the deer population would have problems because there's a check and balance in the system. In the same way, we're learning that in our bacterial populations and in our viral populations, there's actually checks and balances that different viruses have on each other. And actually different viruses interact with the immune system in different ways so that the immune system can better interact with other viruses and other bacteria. It's very, very complicated. And also when you bring in a vaccine, that also causes the viruses that are still in the wild, the bacteria that are still in the wild to mutate, and that also causes issues. So there are these system-wide issues that I'm looking into and that we don't have a handle on, and that would require really long-term testing to know about. Okay, so let me give some examples of things that we do know about. They're not with measles, but with some other vaccines. For example, for preschool entry in California, you need the Hib vaccine, and this is against a particular bacteria which can cause meningitis in young children. Now, the Hib bacteria used to make some children very, very sick, but it also used to be carried frequently by healthy children. It was part of our natural bacterial environment, right? When they started giving the Hib vaccine, yes, they really cut out Hib disease in children, and they really cut out healthy passage. So people weren't carrying this, the little kids weren't carrying this bacteria around anymore. What happened is that other related bacteria that were not covered by the vaccine just jumped into this environmental niche. And these were bacteria, interestingly, that did not used to cause severe disease. It used to just cause like some earache or some tonsillitis or something like that. But we had them, now that that Hib was gone, suddenly these other bacteria are becoming more numerous, and suddenly they're beginning to cause severe disease. We didn't understand this, right? But that's what's happening. Now, in the adult population, it's even a worse problem because all the adults used to be immune to all this stuff, right? But now we're having these bacteria that are evolving because the Hib bacteria is gone. So now they're seeing that in adult populations, the rate of invasive infections by Hib-related bacteria has gone up by a factor of 10 because the kids are getting the vaccine. So this isn't even like an adult's choice to get this vaccine or not. It's because the whole environment has been changed by the vaccine introduction. We also see something like this in chickenpox, that adults who have had chickenpox can get a reactivation of that in shingles, which is much worse than the chickenpox. And this reactivation can be prevented if they're exposed to kids with chickenpox, because being exposed to a kid with chickenpox boosts immunity. They brought on the chickenpox vaccine, and now all the adults have a much higher rate of shingles because they can't be exposed to that boosting anymore. So we have these extended safety issues with how these vaccines change the entire environment, and we can't consider that kind of safety on a short 6-week trial. And despite what I've just told you, we are repeatedly told that there's tons of science supporting the safety of the measles vaccine. And that is because after they licensed the vaccine, they did do a lot of studies looking at people who had received that vaccine. But there are a lot of problems with doing your studies post-licensure. So in the other videos on the stick, I'm going to talk about the studies that have been done, what are the issues with the post-licensure studies. I'm also going to be talking about the effect on the entire viral environment by removing measles or trying to remove measles, because another thing that I'm going to cover is, could we eliminate measles by giving everybody the vaccine? Is the vaccine actually good enough to do that? Because people are given that impression, but it's not necessarily the case. And I also want to strongly urge you to share with somebody else. Right now, everyone is basically at the mercy of the media and of the powers that be. They're telling everyone to be pro-vaccine. People are being pro-vaccine, and we're getting all these laws passed, okay? If we want to reverse that, we have to reverse that communication person to person. We have to take the power as parents to educate ourselves and to educate our neighbors. So everyone needs to take the personal responsibility to learn, and they have to take the responsibility to educate someone else on a grassroots level. So please host meetings at your house to educate others. Read some of these wonderful books that are available on the topic by the experts. Pass these books to other people. The only way we're going to make the difference is to take the power ourselves. Thank you so much.